All right, hello everyone. Welcome back to Unidos Unplugged, the podcast where community culture and wellness take the spotlight. Today we have a very special guest, but before that, I am your host, David Villarreal, outreach specialist for Unidos contra la Diabetes. I am joined by my co-host, our director, Moises Arjona.
Hello, everyone.
And we are joined with a very special guest, Senior Director of DHR Health Transplant Institute, Ms. Traci Salas. Say hello.
Hello.
Awesome. So on that note, Ms. Traci, if you want to just kind of tell the people a little bit about yourself, what it is that you do,
Sure.
and why you're here today.
So, as you mentioned, I'm the Senior Director of Transplant at DHR Transplant Institute. I think I have a pretty cool job. I get to lead a pretty dynamic group of professionals, including physicians and nurses and dietitians and social workers, to do kidney transplants here in the Rio Grande Valley.
Oh, awesome. So, if you want to get into a little bit of what it actually is that DHR Institute of Transplant provides, the services, and your role in all of that.
Sure. So we have a kidney transplant program. We're the only kidney transplant program in the Rio Grande Valley. Outside of that, people would have to travel to Houston, San Antonio, much further places to receive a kidney transplant. We've done 62 kidney transplants so far this year, which is almost double what has been done the previous year. So we've seen a lot of growth this year. But essentially, we provide kidney transplants. We're looking into, and hopefully we'll eventually be starting a liver transplant program as well.
Wow, that's interesting. So I didn't realize that until Ronnie told me the other day that we were doing transplants here in the Rio Grande Valley.
Yeah.
I thought people still had to travel to San Antonio or Galveston or whatever, so that is news to me.
Yeah, I hear that a lot. And we even had earlier this year a 5K that we did. And one of the participants in the 5K came up to us after and he was like, "Oh, I'm on the wait list, And I was like, "Oh, that's awesome. You're on our wait list." And he's like, "No, I didn't even know there was a program here." He said, he's like, "I live down this street." He's like, "I'll be back Monday to apply."
That's
He's like,
great.
"Yeah." So he had been saving money to go to San Antonio because, once you have a transplant, typically you have to stay, 4 to 6
Right.
weeks near the facility where you're transplanted. And that's just not feasible for a lot of people.
It isn't.
And so, if anything, my hope is that more people will find out or realize that they can get transplanted here at home and still receive, world-class care. So that's a big incentive for us to try to get the word out.
Right. I think there's also a big misconception that we have to leave the valley to find good health care. That's not necessarily the truth all the time.
No.
I get that we have bad experiences and stuff, but you know what? If we can get it all stop shop here in the valley, let's just do it, right?
Yeah,
And there's
absolutely.
no point to put our pocketbook,
Yeah.
stretch it out when you don't have to, right?
Especially when it comes to transplantation, because it's really a life change. Like, it's not a one and done kind of procedure. Like, you go and get it done and then that's it.
Yeah.
With transplant, we monitor you very closely post-transplant. You're seen 2 to 3 times in the clinic for the first couple of weeks, and then, twice a week, then weekly, as you recover. And so you want that kind of monitoring after you've had a transplant, and you'd rather not be staying at an Airbnb while making those arrangements and that follow-up care.
Right. And when you're staying somewhere else away from your home, you're not even eating the right way, you're not doing anything the right way, you're putting all these expenses on yourself, and you're even extra nervous and trying to be as careful as you try to be. It's just that doesn't work out.
Yeah, absolutely.
Cool.
I had a question. So, with us, we are always the ones out in the community and telling people like, hey, you need to either manage your diabetes or
Yeah.
better than anything prevent it, because it is very preventable. But who better to explain the I guess the causes of what diabetes
Sure.
does to your organs and more particular your kidneys.
Yeah, absolutely. So diabetes is the leading cause of kidney disease or kidney failure throughout the world. And it's really the high blood sugar that causes the most damage to the small vessels, whether it be in your eyes, your organs, throughout your body. And essentially, that's what it does. When diabetes isn't managed and you have regular high blood glucose levels, it eventually takes a toll on your kidneys. Your kidneys filter your blood, so all the blood through your body ends up at some point traveling through those kidneys. And so that's what causes really the damage is the high blood sugar. Now, you can have diabetes, and if it's well maintained and you have that tight control of your blood glucose, then you can really limit or minimize the damage to your kidneys. Unfortunately, what we see is a lot of people don't even get diagnosed with diabetes until they've had it for a long time, and there's already a level of damage. Same thing with kidney disease. Without regular follow-up, people aren't finding out that they're even in kidney failure until it's too late, and it's already far along. Prevention and control and education is extremely important for especially our community. There are over 4,000 people on dialysis, or around 4,000 people on dialysis in the Rio Grande Valley, and I would be willing to bet that a lot of them had no idea that they had kidney failure until they were ready to start dialysis.
Right. Yeah, and so this is like David mentioned, I go to the worst case scenario for folks when we're doing prevention and awareness. I go, and right now we're seeing obesity in our youth. And when I talk to parents about, hey, so what are some of the dangers of obesity in youth? And I show them the stats of high blood pressure, the uncontrolled snickerins. And I say, what is that telling you right there? And they go, oh, they're going to have a stroke. I said, let's think a little deeper. Heart attack. No, let's think a little deeper. And they can't think of anything. I said, dialysis.
Yeah.
Your blood pressure at this young age, they're obese already for whatever, uncontrolled, and they're already going to be type 2, and they're not even 18 yet, and they're shooting their kidneys because of their high blood pressure.
Yeah, no, you're absolutely right. I can remember actually having a conversation with one of my patients when I was a bedside nurse, telling them that, I think it should be scary, but it's less scary to think, oh, I could end up with a stroke or a heart attack, because again, that's like an event. It's a one-time thing. But when you realize that, no, what if you survive that stroke, you survive that heart attack, and then you end up 3 days a week on dialysis for years, or needing a life-altering kidney transplant. Like, it goes so far beyond just this one major event. Right. And that's what, unfortunately, people don't realize, that it's what happens if you survive those events.
Yes. Yeah. And then the other part of it is, because our culture revolves around food and eating and all that kind of good stuff. I tell people, if you ever get to that point where you're on dialysis, your whole lifestyle is going to change.
Oh my gosh.
You can't have all the liquids you want. You can't, and you have to think about all the food you're eating that already has moisture in it. That's going to be, it's just
it's life altering.
Yeah.
Life altering. Yeah.
So
why do you think it gets? I don't want to say it gets downplayed, but why do you think it doesn't get taken as serious? People don't. We're at the health fairs, and people aren't necessarily they don't go directly to oh yeah, my kidneys. It's kind of like an afterthought.
Yeah, it's an afterthought. I think some of it is just not knowing. I don't think enough is said about it, And then I also think that it's so prevalent that it's not as scary, right? Because everybody knows somebody who's diabetic. And so they have an awareness of it. So it's oh, it's my turn to have it. Or, it's almost like an acceptance, right? It's just become a normal part of our culture,
It is.
especially here. I mean, there's not, I'm fairly new. I've been, October will be a year since I moved here from the Dallas-Fort Worth area. And I knew coming into it, and part of the thing that drew me to this area was the need, right? There with, being somewhat, I guess you could say, smaller population, but still the prevalence of diabetes and renal failure. And then a program here that could serve those people and increase access to people that need it most was what drew me here. But I also see kind of a nonchalance, if you will, about it. It's oh, yeah.
Yeah.
Oh yeah, she's got diabetes.
Yeah.
Oh yeah.
You hit it right on the nose. So we always talk about that rite of passage. My grandma had it, my grandpa had it, I have it, my mom had it. We're all gonna have it. So it's one of those things where I'm not gonna change my lifestyle because I'm gonna get it anyway. And I'm no, you can.
You can. You can.
And one of the things I think that we also try to emphasize is, do you understand the level of care and the responsibility you put on your loved ones? Because your loved ones are the ones going to take the toll for it.
Yeah.
Your son now or daughter now becomes a caregiver, or and vice versa.
Sure.
And I always use this, and people look at me really funny and upset when I say, so you're going to take the parent now, mom, is going to take her mom to dialysis, and the next thing she's going to do is taking her daughter to dialysis too. And they're just looking at me like, no. I'm like, well, yeah, bro, that's what's going to happen.
Yeah, that's what happens. You're exactly right. And even with transplantation, one of the main things that we look at when we're evaluating somebody to determine if they're a candidate is if they have caregiver support, because it is such a lifestyle change. So, it doesn't just impact you. It's not like you just get a kidney transplant and then you're in the hospital a couple of days and that's it. You're back to normal. That's not exactly how it happens. Yes, it does improve your lifestyle. It has the ability to add years onto your life. But there's a huge transition period where you have to have a caregiver. The first, we encourage like 6 to 8 weeks after transplant, someone to take you to your appointments and help you manage your new medication regime and, like all of those things. So,
yeah, it's really hard. And so I'm a bariatric patient, 17 years post-op, and you're absolutely right. The whole caregiver, the whole atmosphere at home, everything has to change in order for you to be successful on your journey.
Yeah.
And for me, it was one of those things where, I can't have pizzas anymore. I can't have Whataburgers. But if I smell pizzas at the home and I smell Whataburgers, and I don't want to eat all that junk food all the time. So what was the purpose of me having the surgery, right? But it's an life-altering process, and you have to encourage your whole family to join you on that process.
Absolutely.
And one of the biggest things we talk about also in diabetes is, we go to quinceañeras and we go to weddings, and the first person to get the biggest slice of cake is grandma. And grandma's diabetic. And then grandma finishes the cake, and then she says, bring me a piece to go home.
Yeah.
And another big piece, right? So again, we have to change that culture. We have to understand that, yes, it's prevalent, but we can reverse it, prevent it, and work forward at a longer, healthier life.
Yeah, and it doesn't mean that we have to remove all the fun
Exactly.
out of things.
It's all in small portions.
Yeah, it's all in small portions. It doesn't mean the cake can't exist.
Exactly.
Right.
And it's just I'm a sugar addict. I love sugar. I'm just gonna roll around the frosting and just love.
I like carbs.
Oh, there you go.
So before we get into deeper into like the process and evaluating someone for a transplant and all that goes into it, do you have any? Again, we can speak all day about preventative.
Sure.
Do you have any particular preventative steps from your point of view that you like to implement or tell people?
I just encourage regular health checkups and monitoring, especially if you already know that you are diabetic or that you're maybe pre-diabetic. Getting control of your blood sugar as best you can to be managed. I mean, there's so many cool technologies and devices today that can help diabetic patients maintain so that they're not constantly spiking and then dropping and that sort of thing, and helping them live pretty full life. To do those things, to get their kidneys checked out, to get blood tests done on a regular basis to make sure that they're not headed down that path, and if they are, follow what their providers are directing them to do. Like I said, controlling it's great. There are medications out there that can be protective of the kidneys as well. But you have to know that it's going on in order to seek out those kinds of things.
Really quick. So it's just a simple blood test can let you know what your level of kidney function is, and your urine test maybe?
Correct.
No?
Yes.
Okay.
Urine test, blood test. They can check your creatinine level, which measures your kidney function. They can test your urine. What happens is when your blood sugar or high blood pressure can cause you to have protein in your urine, so they can check your urine for proteins. That's an indication that some damage is going on. So there are things like that that can help. I mean, really early detection and then maintenance is key until you get to the part where it's not reversible, and then you have to come see us.
Yeah.
Right.
Okay, cool.
So let's say, can you get into a little bit more detail of take us from
The process?
evaluating? Yeah,
sure. So usually what happens is we receive a referral. People can self-refer themselves to our program. Unfortunately, a lot of times those referrals, or the majority of the time, those come from the dialysis centers. So it's patients already on dialysis. Although it's important for people to understand that if they know they have late stage chronic kidney disease, they can still qualify for a transplant. And we actually, it's much better for people to get transplanted before they start dialysis than after. So that's even an option. But usually we get a referral, and then someone on my team contacts them. We check out the insurance, make sure that they have coverage. We can even help recommend, coverage changes if, that might better suit their needs. And then they get in touch with a nurse, and a nurse will call them, go over their health history, schedule them for an education forum at our clinic. And then really everything happens in about 3 appointments, 2 to 3 appointments. They come in for an education forum. They come into a clinic appointment where they meet our physicians, our surgeon, our dietitian. It's a long appointment, but you get to meet everybody and ask a bunch of questions. And then from that evaluation, we determine what testing is needed. And so the next appointments are usually for the testing. Once everything is complete, the nurse coordinator will present them at our selection committee to try to get them approved for the wait list. So everything leading up to it is just making sure that this person's going to be a good candidate, that this is a safe and healthy option for them, and getting them educated all along the way about what life will be like, with the transplant and post-transplant. And then it doesn't really stop there. You have the transplant, and then our clinic still follows patients well after transplant. We see them right after the clinic, and the cool part is it's often the same team that worked them up for transplant, so we really get to know our patients and kind of follow along this journey with them.
I think it's really cool what you mentioned. I mean, the whole process that you mentioned is probably, I'm already overwhelmed with it, right? But safe for the patient as well.
Yeah.
I think that's something really key, right? Because sometimes you think, well, I'm just get a kidney transplant and I'm going to have a successful life. But maybe there are other factors in there that have to be considered. And if maybe, not to say that it's best to be under us or not, but if you're not safe for the whole operation to go through I'm sure it's an invasive procedure, right?
Absolutely. So, studies have shown that people can live a longer life with a kidney transplant than if they are to remain on dialysis. So that is the optimal choice, is with a kidney transplant. But like with any surgery, there are risks. The most common complication post-transplant is not rejection or kidney failure. It's actually a cardiac event. So a lot of the testing that we do before transplant is to make sure that your heart is, strong enough to survive the surgery and the effects after the surgery. So cardiac testing is, a big part of what we do as well. But yeah, everything is leading up to how are we going to help you be successful after transplant. Even our evaluation with our social workers, we're looking at things like, do you have a caregiver? Are there things like food insecurity? Are you going to have access to medical, care? Are you going to be able to afford your prescriptions after? Everything is optimizing or trying to optimize a plan for how we're going to make you successful after transplant.
Right. And then because DHR is a huge health system, you all have the doctor referrals within the system to go ahead and get all that done, right?
Yes.
So I don't have to go look.
Cool.
I don't have to go wait for a cardiologist 6 months away. 6 months to just get the appointment and stuff, right?
Absolutely. One of the things that absolutely blew my mind when I came to DHR was the ability that this system has to really be like a one-stop shop. And that's amazing. Even being in a big area like Dallas-Fort Worth, we didn't always have like women's services to make sure that, patients had their pap smear, were up to date on their cancer screenings. It was something we had to refer outside and rely on them to, the patient to really drive that process and get all the testing they need done. Here I have these amazing transplant assistants that once they, are seen and know what testing you need, they get you scheduled for everything.
That's great.
Yeah, it's amazing. We even have been working with our radiology department to have slots reserved just for our, evaluation transplant patients, so that the goal is that we can even reduce eventually how many appointments people have to come to the transplant clinic. Like they could come see our team and then go downstairs and have their imaging done, potentially even that same day.
Yay,
So
that's great.
it's amazing. It's
So you made it a science. You made it an art. Yeah. Get it all taken care
I like
of.
that. That sounds like I do a really good job.
Yeah.
I like
Yeah.
that.
Well, I mean, it's always comes a therapy session for Moses, but I had. Trust me, I find a way to get myself in my issues in here.
Yeah, I like that.
I had a bilateral hernia repair a year ago, and then I re-injured myself. So it took from the moment I went to the doctor and I said, hey, I need an MRI or a CT scan or something, it took me like 4 months just to get the appointment. It's kind of crazy.
It is crazy. It is crazy.
So I'm glad that you mentioned that it's a one-stop shop. People can get everything there.
Yeah.
You don't have to worry about the appointments. You take care of everything, and they move forward.
And you know what I love about it too is it really helps with the communication between providers too. So if we refer you to, which if you're coming for a transplant, we probably will, to a cardiologist, then, you know, our physicians are able to really communicate very easily back and forth with that cardiology team. And even when you're inpatient after having your transplant surgery, because your physicians are there at DHR, you're going to see people that are familiar with your case.
Yeah.
So it's nice.
Yeah. One big family.
Yeah. So, and correct me if I'm wrong, I'm assuming a lot of these patients that get the transplants are diabetic.
Yeah.
Okay, so how does diabetes affect post-op? Let's say they have a successful surgery.
Oh, I hadn't thought about that.
Yeah, how does that?
That's a very good question.
I hadn't thought about that. I was like, it's a cure.
Yeah,
We're done.
no.
Is there?
No, there's still work to be done.
That's a mind blow right there for me.
Yeah.
I didn't thought about that.
So, it can't, so just like it, you know, if you're not managing your diabetes, then you could still cause damage to your transplanted kidney. So a lot of it is optimizing your care after transplant. We have a wonderful team. And like I said, we have a dedicated transplant dietitian, pharmacist. So a lot of it starts with education. And when I say education, I mean, we start doing education inpatient, like pretty much as soon as you wake up from surgery.
Wow.
So our pharmacist will even come bedside and, you know, start talking to you about how we're going to manage, you know, your diabetes and talk to you about, you know, what range we need to be in with your blood sugars. And we're constantly reviewing and optimizing care. That's why people come so frequently to the clinic post-transplant, especially immediately after. A lot of the medications can actually increase your blood sugar to some extent. So the regimen you were on prior to transplant may need to be changed. And so we're just really monitoring you very closely until we develop, you know, a rhythm. But post-transplant, there are a lot of things out there even now that can help with that. I mean, studies are being done even now to see what these GLP-1s and some of these other medications have some cardiac and even kidney protection, you know, that we think may be there. So, but really it's going to be optimizing your medical management and your diet and, you know, that sort of stuff after transplant. The cool thing though is that people who have been on dialysis, once they get a transplant, you know, they've been so restricted with their fluids and their diet and that sort of thing. And then they get a functioning kidney and it's like a second chance because, you know, now before you may not have been able to drink more than, you know, 500 mLs of water. Now I'm asking you to drink, you know, 4 liters of water a day and you couldn't have potassium. And now I'm like, I'm like, your sodium's too low, you know, because you've been so restrictive for so long. So it opens up a whole new world of opportunity.
Yeah. I hadn't even thought about that, actually. That's
Right.
really cool.
So you guys do see a good amount of like, do you see a good amount of like, oh, I get it now after?
Yeah.
I know sometimes it's like not best case scenario because they still had to get the transplant.
Yeah.
But they kind of get that like click, like, oh.
You know, over the years, I've been in transplant. I've been fortunate I was a bedside nurse in transplant before I became a transplant coordinator and then, you know, a transplant administrator. So I've gotten to see all sides of it before and after transplant. And it's interesting. There's a variety of responses, I think. I think the most common one is the thought that getting the surgery, you know, even though we try to teach people otherwise, they think it's a one and done. Like, I get the transplant, I'm cured. I can go back to, you know, the second piece of cake that, you know, is offered at the party or whatever. But a lot of it, though, is gratitude, and the aha moments are my favorite because it really is a second chance at life. And so there are many, many people who get transplanted and treat it just like that, the gift that it is.
So just in your experience, and I know it's not here, but on the question, but what's the youngest transplant you've seen and the oldest transplant you've seen?
Well, they do. I've only worked at adult centers. Okay. They do pediatric transplants. A very dear friend of mine, her daughter had a transplant. I want to say she was like 11 when she had her transplant. But the youngest that I've been involved in myself is probably 18. Yeah.
Okay.
Yeah.
So I know we touched on it a little bit. You mentioned like the GLP-1s and stuff like that. Is there any advancements in transplant medicine that are coming up that you guys know of that you're excited for or anything like that?
There's lots of things that we're excited for. So there are different perfusion and transport technologies that have really developed. Being here in the Rio Grande Valley, getting kidneys here can be an interesting challenge. I don't know if you've had flights delayed, but those same flights are the ones that are used to bring the kidneys to us. So there's a lot of cool technologies that are allowing kidneys to travel further or remain viable longer outside of the body. And so those are very cool things. Some of the kidneys that we have gotten even this year have been out of state from places like California and things like that. So that's cool because it makes it more accessible to the people here. And then another cool advancement too is just some of the medications and stuff, like I mentioned, post-op that can really help people manage their diabetes better, post-transplant so that it lasts as long as possible. And also advances in the immunosuppression medication. A lot of people worry about getting a transplant and having to be on this lifelong medicine that's going to suppress your immune system that has all these side effects. And there's lots of advances in that to help minimize how much immunosuppression you have to be on. So that's also something I think we're excited about too.
Yeah, I think one of the things that we when we met with TOSA was we needed to help increase our numbers here in the Rio Grande Valley to increase our donors. So you mentioned, we have kidneys coming in from out of state.
Yeah.
But we have such a huge population here
do.
who use it. We need to
do.
increase the numbers. So I was a proponent of, I was an opponent of being a donor.
You were an opponent?
I mean,
you were opposed?
I was opposed. I mean, I wanted to be like an Egyptian. Bury me with all my organs. Bury me with everything complete.
That's so common, though.
It is, but I don't know why I thought that way, right? So we had our meeting last week, and on your Apple phone, when you go to the health check, you can actually register to be a donor there. So I just clicked. I finally just click it. It's not going to hurt me. If someone can use my organs when I pass, great.
It's just one of those things, I think, in our community, the Hispanic community, that we fall into like, oh, they're not going to give me proper care if something's wrong with me. I generally do believe that it boils down to that. We had a whole conversation with Mauricio about that from TOSA. And from all the stuff he told us, I still think it's all gonna boil down to people are just like, no, I'm
trusting. Yeah.
Yeah.
It's having trust. Having been an ICU nurse, I can honestly say that it doesn't affect being a donor. Doesn't even play a factor into the care that you receive, especially when you're in those critical, stages. The idea or the thought of even organ donation isn't even touched until things are so far gone that we realize that may be the only next, logical next step. Even my own mother is the same way, though, to be honest. And she, when she was like going through like her will planning and her advanced directives and stuff, she's like, no. I want, I want all the care to the very end. And I was like, it doesn't mean you don't get the care till the end, huh? So, no, I definitely understand that. And I think we have to educate people and and earn their trust to change that perspective. Dr. Crespo, one of our transplant surgeons, told this really beautiful story at one of our things. And I may have even been like a parable. I don't know. And I'll probably mess it up if I try, but whatever. So it was essentially about this really wealthy man who was passing, and he had this beautiful, full luxury car, and he wanted to be buried with a car. And everyone was like, how selfish.
I know.
Like you can't even drive the car, like in the next life. Like,
but I want to be buried.
Yeah. How many people could use that car? Like what a selfish, thing or whatever. But we don't think that way when we're talking about our organs. Like we don't say like, oh, they weren't a donor. That's awful. We don't think that way. But it's true. There's so like you can't. What are you going to do with those once you pass? But it is a very personal decision, and I think as healthcare providers, we have to respect that. But I think we could do a lot to educate people on just how much they could change their lives, and especially if it's a loved one. I have heard so many stories from people, survivors of donors, about how much donating their organs really helped them feel like their loved one is living on, and just be super proud of the gift that person was able to give somebody, and almost even a connection to their loved one after donation, because there's somebody walking around with their heart or with their kidneys, or those kind of things. So many lives can be touched with even just one donor.
Yeah, 2020 and Lifetime, Time Life, or is it Lifetime? Lifetime. They have some really good shows about when someone receives an organ and how their loved one is living through someone else, and then they make. I mean, it's amazing. It's very touching.
It's touching. It's very touching. And there's even opportunities to be a living donor. And I think there's a lot that we have to encourage people to understand about the living donation process. I mean, you can be a donor here in this lifetime and be proud and get to experience that yourself, like how you're helping other people, especially when it comes to living donor kidneys. People can live full, healthy lives after donating a kidney. I mean, women can still have babies after donation. There's a whole group of donors out there that do these ultra marathons and climb mountains, and I've got both my kidneys and I don't do any of that.
Yeah,
stuff.
neither do I. Neither do I.
Yeah.
But it's like a renewed sense of life for them, right?
Sure.
So it's a different way, but yeah. They have a second chance at life, and they're taking advantage of it in a different way, and they're no longer in survival mode. They're in living mode.
Absolutely.
So as we start winding down here a little bit, just on the topic, how can we as a community just help support the mission that you guys are on? Us here at Unidos, and just in general for anyone listening.
I think talking about it, educating people, sharing, stories, getting people who've lived through it, had a transplant, or those who have actually been a living donor, getting those people out in front of the community. I can talk about it all day, but it's not going to be the same as hearing it from somebody who's experienced it. Right. And doing everything we can to help increase access to healthcare, to make sure that people are finding out that they have diabetes. If we can't prevent it completely, making sure that they find out early that they have it, and educating them on how to manage their diabetes, and getting them to understand that it's not necessarily the stroke or heart attack you have to be afraid of, that it's these lifelong complications that are really a problem. So I think anytime we have the opportunity to talk about it, to talk about being a donor, to talk about, the dangers of diabetes and that sort of stuff is a responsibility that we can all share.
Yeah, and one of the things that we like to do is someone told me a long time ago, I have insurance, but every time I see a health fair, I go and stop and get my screenings done because it's free, and I get to know exactly where I'm at before I have to go through the next 3 or 6 months, right? So I always tell people, take advantage of health fairs. If there's a screening being done, get it done.
Absolutely.
It's not going to hurt you. It's free.
So, what's crazy is one of the first events I ever went to at DHR was the DHR Health Fair. I can't remember. It must have been like November or so. When do they normally do it? I think it's like November. It was right after I moved here. And I was so impressed with how many people were there, how much cool stuff gets handed out. But also you could do like a liver scan there. They were doing lab work there. They were doing, there was so much you could do. It's like you can get a water bottle and a liver scan all in the same place. Who doesn't want to spend an afternoon doing that?
I know. So I think it's one of those things that we need to encourage folks. And I tell people, stop by. It's free. You're getting good care, and you're getting all these results, and it's not going through your insurance and all that stuff.
I think we just have a very skeptical community.
Yeah, we do. But it wasn't like a high pressure sales situation, like buying a timeshare or anything. Like it was like, it was literally like a fun event that you went from table to table, and you got a bunch of cool swag and. So definitely community health fairs are not to be avoided.
Yeah, and so with the same token, I just, I always give a hard time to a lot of folks because we go to health fairs, and David knows where I'm going with it. Hey, here's your blood pressure check, and here's a bag of Cheetos for you.
Yeah, I know.
So we have a whole push to do that, and our community partners have done such a great job of actually changing their strategies and doing the swag. Yeah. I think we can do that a lot better. It's easier, it's healthier, and we have the same message, Yeah. It's about keeping our community safe and healthy. And it's like I tell people, people can buy junk food all the time. So it's not gonna don't give me that excuse. Well, it's for the poor people.
No, it's not. And I can attest, I think DHR has some of the coolest swag I've seen. I'll probably get in trouble for saying
Well,
that.
I just
but-
received a cute. Well, we all received a cute bag, but I think I'm gonna keep them all for myself. But the
Yeah.
cute swag.
Oh man,
Yeah.
and like that's one thing too that we get real crafty when we're ordering it too. We have some cool like pill boxes and just like reasonable stuff, like things that
Things
you
that can be
need.
used.
Useful
Yeah.
stuff.
That's the way. So just so that you know, I don't call our swag. I call our swag health education materials.
Yeah.
Because they're look at me getting all
Look
technical
at
on you.
you.
Look at me.
Wow.
Because it has to be able to be used.
Yeah.
I don't want them to be put in a bag or in a corner.
Yeah.
The pill boxes, great. We love
Yes.
them. Manicure kit.
Yeah.
Needs it, especially for our diabetic patients. You can't have all this type of stuff,
Yeah.
right? All this type of stuff. We have to use it
It's got to be useful.
useful. Sunglasses, useful. Make them
Yeah.
make them nice and swaggy and stuff, but
Yeah.
put your message on it. Great. I love
Yeah.
that. The water bottle's great. And I tell people when I give them a water bottle, I don't want to see a Coke in it. I don't want to see
Yeah.
because that's or you know.
Just a healthy bit of shame
Yeah,
there.
yeah. No, I tell Eric. I mean, I'm not. I said, and do not post it on social media with a drink on it.
Yeah.
I'll get
like
all
that.
upset. But yeah, I think you're absolutely right. The materials or the swag that's given out, it's all
Yeah.
things that can be used.
Absolutely. Things that are useful.
Yeah.
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 Awesome. So much useful information that was given out here. We are getting close to the end here. I always like to end it on a particular question.
Oh.
If you don't have anything else that you might want to add, I can kind of
Go for it.
get onto it.
Yeah.
So we ask all our guests that come onto the podcast the same question, and that question is, what does success look like to you? So, just in general, overall.
Okay, so much pressure. Gosh. I don't think it can mean just one thing for me, because I think true success would be the ability to prevent people from getting or slowing, diabetes and these chronic illnesses that lead to end-stage renal disease and ultimately kidney transplant. The dream would be that it's not even an issue, that it really puts me out of business. I just don't know that that's truly a possibility. So then I guess my real life idea of success would be that if people need kidney transplants, that they're able and understand and are have access to it here at home in the Rio Grande Valley, that they know that they're going to get the best possible care, that you don't have to travel far. And if that means that it's more affordable, more accessible to the people here, then I'm thrilled. In a lot of ways, I feel like very proud of the work that we've done even in the last year that I've been involved with this program. I'm so proud of the people that work here and so honored to be part of a system that's so supportive that has allowed us to be able to really double the number of transplants that are done right here at home. I mean, like I said, we did the most I think previously ever done was 49. We've done 62 this year.
That's great.
And we still have a couple months left. And it makes me very excited for the future that, with over 4,000 people on dialysis here, there's so many more people that need it. Just making it accessible and giving people that hope that it can be done here would be success. How was that?
That was
That
great.
was
That was
perfect.
perfect. And again, we just reiterated that,
So much stress.
stress. Bringing your family, staying here with your family
Yes.
in your own hometown, getting the care you need, being
Yeah.
Nothing better.
Nothing better than and not making those expenses that you don't need, because we as a family unit, we all like to travel. So you have 100 people going with you everywhere you go,
absolutely.
and it gets crazy.
It gets crazy.
Yeah.
There's actually a site, srtr.org, that compares transplant programs across the nation. Every transplant program is on it. And every 6 months they update their data. And if you look at the most recent data, and anybody can access this site, you'll see that we have higher scores than a lot of our quote unquote competitors, the closer programs where a lot of the patients are going to. We have higher outcomes. We have quicker times to transplant. So it's not even necessary. It's not like, I can't stay here because the quality isn't there. The
Right.
quality is here.
Right. Yeah. I think there's a big misconception, as I said earlier. People
Yeah.
feel that they need to get better care outside of the valley, and I think for the most part, yeah, you do have those bad experiences, but we do have amazing medical health systems here that can do a lot of work for us, take care of us.
All right. On that note, before I wrap us up here, Miss Traci, thank you so much for all the info. And if there's anything else that you'd want to plug, that you guys, where can people find you? That you guys might have something coming
Sure.
up, anything like that?
Yep, you can go to any of the DHR websites and get to us through transplant. I encourage anybody who's interested in being a donor to register to donate. As you mentioned, there's even an app on your iPhone or the portion of the iPhone where you can do that. You can also, register on Life Gift's website. So I just want to encourage that. And then again, if you are needing a kidney transplant, you can always hit us up here in the Rio Grande Valley at DHR Transplant Institute.
Awesome.
Awesome. Well, on that note, we hope you guys enjoyed today's episode of Unidos Unplugged, and we hope to see you guys on the next one. Thank you so much.